Superhumanize. Accelerated evolution.
Have you ever wondered how many women have silently suffered because of fear-driven misinformation about hormone replacement therapy? For years, HRT was vilified, leaving countless women struggling through perimenopause, menopause, and beyond, without the tools to thrive. But what if the story we've been told is incomplete? What if HRT isn't the villain, but a powerful ally in women's health? Dr. Beth DuPree is here to rewrite that narrative. A board-certified general surgeon specializing in breast cancer and an integrative holistic medicine practitioner, she has spent decades at the cutting edge of patient care. Her credentials are extraordinary: a pioneer in breast cancer surgery, an expert in integrative medicine, and now certified in psychedelic-assisted therapies. Dr. DuPree has made it her mission to combine science and soul in the pursuit of true healing. In this episode, we'll explore her remarkable journey, one that led her from skepticism to becoming a passionate advocate for HRT. We'll discuss how she's reversing osteopenia and how she's helping women take back control of their health, all while challenging outdated medical paradigms. This conversation will empower you to question the status quo and embrace the possibilities for a healthier, more vibrant life. Beth, welcome to the Superhumanized podcast. This has been long overdue, not just because of the incredible work that you do, also because you are an incredible friend. I am so thrilled to welcome you on the show today.
I am so thrilled to be here, and I know that we could talk about so many topics, but this is a topic for me it's very timely because we're in the time in our culture where a lot of people are afraid to say, I didn't know what I didn't know. I need to change my opinion on something, because when people change their opinion, they tend to get canceled and written off. And sometimes you get new data, you have a different way of looking at science. And I think it's a really important lesson for our society to learn that as we evolve, we are adapting and adjusting to information as we get it. And my views when I was 40 years old about this topic are very different than my views as a 63-year-old who is looking at hormone replacement therapy and its implications in a very different light. So I'm happy to start where we're starting now, and we'll jump into a million other topics as the years progress.
And as you said, our big topic today is hormone replacement therapy. And what I love about you so much, and what you so aptly pointed out, is what we have going on in our culture where people are not allowed to change their minds. Life is change. We evolve. We get better information. And your life, your path has actually been very remarkable in the sense that you have evolved and shifted and embraced change so much. So just to give our audience some context before we jump into our main topic, your career has been a remarkable blend of cutting-edge Western medicine and integrative healing approach. You're, as I mentioned in the introduction, a breast cancer surgeon with decades of experience. You're a thought leader in integrative medicine. You are a champion for holistic patient care. And adding to this, just to round the picture out, your certification in psychedelic-assisted therapies reflects your deep, your profound commitment to exploring the full spectrum of healing. So that being said, Beth, and to give our audience a starting point to understand, and I say this with so much love, the phenomenal woman that you are, can you share with us the pivotal moments that shaped your journey from being a distinguished breast cancer surgeon to embracing integrative and holistic medicine?
First of all, I love the way that you pronounce integrative medicine, because to me, it is the integrity of integrative medicine that brings us back to a place of looking at the whole person, treating the whole person. And so I love your pronunciation, because to me, it speaks volumes about what we are actually talking about when we treat whole patients. I've been trained by some of the best surgeons in the world. I started out my surgical training at Albert Einstein Medical Center here in Philadelphia, where I am sitting today. I was given, by the grace of God, these amazing surgeons to learn from, to learn surgical skills that have carried me through general surgery into a subspecialty in breast cancer. And during that training, I recognized that as we cut out a cancer from someone's physical body, we are only removing that aspect of the physical manifestation of that cancer at that time. The body heals it, the body brings the edges of the incision back together, the wounds heal, and except for a little scar, that's what's left. But what we didn't address in my Western medical training was, if we remove the cancer from that soil and we don't address that soil that those seeds can grow in again, we have not changed the microenvironment in that person. Looking at someone from a mind, body, spirit perspective, Western medicine really focuses on the body. And so the mental and spiritual aspects are very often pushed aside, because in Western medicine, we're trained to cut is to cure. Nothing heals like cold steel. Here's the pill for your ill. Let me alleviate your symptom. But what we have to do is functionally look at the human being as a being that encompasses their body, their spirit, and their mind. And when we fail to look at that full collective aspect of being a human, we're missing many important pieces in how we treat our patients. And although I learned I can give you a textbook list of how we treat a cancer, what surgery, what chemo, what radiation, which I very much believe in, and I do. I've been doing it for the past 38 years. But through my own knowledge of learning extra education in integrative medicine, additional education in psychedelic therapy, I've realized that nutrition, exercise oncology, and most importantly, what this last chapter of my career has brought me to is psychosocial emotional healing through breath work, through trauma therapy, and through beautiful entheogens such as psilocybin and MDMA and ayahuasca and plant medicines, where these indigenous gifts that have been here forever have been discounted because we've become so industrialized and medicalized in how we treat dis-ease in the body. And so we are in for a great reset in this. And that's the charge that I need to be leading as we move forward, because doctors have to have had a absolutely stellar reputation as a Western medicine thought leader, expert, because if those doctors aren't respected by their colleagues across the board, bringing in nutrition, exercise oncology, psychedelic therapy will never, ever be able to come into mainstream medicine. And that's my why. That's what I'm doing for the rest of my practicing career, is being that change agent that is just going to continue to push that envelope.
Mm. Amen, Sister Beth. I just have so much respect and admiration for you and the course that you have charted. And this change is so sorely needed, and in so many different aspects. Now, today, we wanted to focus on hormone replacement therapy and how that fits into this new paradigm, especially being championed by someone such as yourself, whose name is intimately tied with helping individuals to heal from breast cancer. So thank you for giving us this overview on who you are, who you be, and also what your why is. In order for us to dive into hormone replacement therapy and the backstory, you already mentioned you were very much against it. Years ago, you were actually on an interview at MSNBC where you very much voiced your concerns about this. To give this a little bit of a backdraw for our audience, let's start talking about the Women's Health Initiative study that was the study that has had such a seismic impact on how hormone replacement therapy was viewed in the medical community, and how for many years these findings shaped guidelines and instilled so much fear. What actually led you to pivot from the skepticism that you had to advocacy for HRT, and how did your personal experience with osteopenia and its reversal through HRT and weight training influenced this shift, Beth?
So when the Women's Health Initiative first hit the newswaves, I guess it was like around 2003. And this was a study which was very flawed, but I didn't realize how flawed it was until I took a deep dive into it, because when papers get published on research and research is done, a lot of times the media grabs a few sentences and they want to run with it and they want to make that the entire story. And initially, I was early on in my breast cancer surgery career in early 2000s when the first study came out. And the sad part is the study never showed a statistically significant increase in breast cancer. It was just an association. There was a slight increase. And this is where you look at relative risk and absolute risk. Relative risk, if you use that way of looking at something, it always sounds worse than what the absolute risk is. So let's say if you have a relative risk of events out of 1,000 versus 3 events out of 1,000, the difference is a 3% absolute difference, but it's a 36% relative risk. So it's the way that things are sold sometimes in the media that can really create what I considered a world of fear. And so what happened was when the first study was first released, women went off HRT like nothing. And they were scared because it was a fear tactic. And it was like, oh my gosh, coronary heart disease is worse. And it was statistically insignificant, but it's because they saw an association and it was able to grab headlines. So tons of women went off hormone replacement therapy. And then they saw a drop in breast cancer, which they also were like, oh, this has to be associated. But this is the one premise, the one thing that people really need to understand is that estrogen doesn't cause a woman to get breast cancer. A woman is going to get breast cancer, whether she's on hormone replacement or not, if she's going to get breast cancer. But the thought is that if you have an estrogen-driven cancer and we give you estrogen, we are dumping fuel on that fire that can make that fire burn worse, which is where physicians who prescribed hormone replacement therapy got very scared, because it's like nobody wanted to be responsible for getting someone's cancer. So anyway, in 2010, how I got pulled into this, I was in my office working and I got a phone call from my husband that some producer from NBC wanted me to go on TV that night and talk about the Women's Health Initiative study that was being released the next day. I said, that's great, except it's embargoed. They get the study. I don't get the study. So I got the study. I had a couple bullet points off of it. And at the time I was 40 years old. So I didn't have hormone. I didn't have menopausal symptoms. I didn't have hot flashes. I had not gone through, my mom hadn't broken either of her hips at that point from osteoporosis. So it was more of it's like I was looking at it from far away. And when you read the study pretty much was trying to sell the fact that cancers had a higher risk of node positivity. And they were saying that combined estrogen and progesterone replacement therapy led to worse outcomes in women. It didn't lead to a higher incidence of death. So there was no difference in mortality. It was just a difference in who was getting diagnosed. So when I went onto NBC, I had what I call now my inappropriate attitude of, we're just treating symptoms of menopause. It's a normal part of life. Why do we have to give someone a medication? And there are lots of wonderful homeopathic, holistic, integrative ways to treat the symptoms of menopause: sleep, hot flashes, night sweats. But what I wasn't really thinking about at the time was, what are the effects on a woman's body when estrogen gets pulled away very quickly, which we do every single day in breast cancer surgery. We literally cut off women's estrogen supplies. So I had not been anti-hormone replacement. I had just been very judicious about who I was willing to let go on hormone replacement therapy. And the one thing out of all of these studies that never, ever makes the headlines in the New York Times is women that don't have a uterus, so women who've already had their uterus surgically removed, that go on estrogen replacement alone, actually have a lower incidence of breast cancer. And that, to me, that should have been like a tagline constantly, so that if women had already had their uterus removed, they could say, okay, listen, I can safely take estrogen replacement. There was some association with stroke and coronary artery disease, but it wasn't being done in a clean way, if that makes sense. The study didn't have the cleanliness to it, because that initial study had women that were already 10, 15 years postmenopause. They were overweight, many of them. Many had smoked. So they already had years of potentially developing coronary heart disease and other issues. What led me to my aha moment? Yes, watching my mom break both of her hips and be in a wheelchair at the end of her life as was a woman suffering with Alzheimer's. I came for my mammogram a year ago, August, and I got my first DEXA scan. I was a gymnast, an athlete, and I'm expecting my DEXA scan to be pristine. The tech gave me the look in the eye, like she didn't want to tell me what my results were because it had to go to the doctor to be interpreted. And I got my DEXA and I'm like, oh my God, how can I have osteopenia? And I had lost an inch in height, which really bummed me out because I like being taller. And I had that moment of, oh my God, my partner Stacy and my surgical partner Stacy got her DEXA scan right afterwards. She ended up having osteoporosis and actually fell 2 days later and broke her elbow, which you cannot make this up. So the two of us were like, here we are, respected Philly top doc, breast cancer surgeons, and we're now ourselves in the swirl of, wow, did we do a disservice to ourselves by not going on hormone replacement therapy earlier? So Jason Wesley, my primary, who I love, my integrative primary, he said, you need to read the book Estrogen Matters, which I did. And that was the book that really took the deep dive into the research, the data, kind of how things were blown out of proportion. And then I went back and I pulled all the studies. I pulled the initial Women's Health Initiative. I pulled the follow-up in 2010. I pulled up the all of the studies that basically looked at the criticisms of the study. And it was a very flawed study. It wasn't truly prospective randomized. And I'm thinking, my God, the women in the United States of America are basing their poo-pooing of hormone replacement therapy on flawed studies. And women's medical studies aren't often, like, we're not top of the heap when it comes to clinical trials for caring for us. So Estrogen Matters started the process. And I said to Jason, okay, I'm ready to go on hormone replacement. I'm doing it. I don't have any family history of breast cancer. We don't carry any genetic predisposition to breast cancer. I do have a factor V Leiden, which we found out through my one sister when she had a pulmonary embolism. So I am at a slightly higher risk of clotting, but there's been no data to show that I should stay off of it for those reasons. I started in September of 2023, and my plan was to do my hormone replacement. And I literally am a pretty fit person, but there have been times in my life where I've had fitness pauses, shall we call them, where I haven't been doing as much. I've started climbing the back of my mountain in Sedona with 15 pounds, or I'm up to 15 pounds on my back, started at 10, called axial loading because my spine had diminished bone density. And I started strength training, and shout out to Ben Aldis on Peloton because my daughter-in-law turned me on to him, and he has a program called Stronger You. And I was like, you know what? I didn't have time to go to be with a trainer. So I take Ben Aldis in my iPad with me. And I did 3 different sets of 4 weeks of strength training with Ben Aldis as my personal trainer on Peloton.
Yes.
Someday I'd love to meet him.
I want to interject real quick, Beth, because I have seen you the last time this past summer, and you've always been in good shape. However, the difference that I saw, you were absolutely rocking. And this not from a purely vanity aesthetic perspective, but just seeing you vital and the shapes of your muscles, like incredible, the physical change that you underwent. And my husband Clay saw you more recently, I think just a few weeks ago, and he said it's even. I was not even able to imagine how you could have gotten even better since the summer, but apparently you did. So what you're doing is clearly working, and not only visually, but you did another DEXA scan.
Right. So one of the things that we use bioimpedance in the office to measure our patients to look at to make sure they're not getting lymphedema. And because we have the bioimpedance, we can also measure skeletal muscle mass, body fat. And so I did my baseline measurement last spring, and then I did one 6 months later this fall because I wanted to make sure that I was doing this right. Because if you're doing strength training appropriately, the scale is not going to, your weight on your scale is not going to change as much as your biometrics. And I was stupid at first because I got on the scale and my weight was going up. And I was like, all right, I'm eating healthy. I'm exercising more. I'm lifting weight, but muscle weighs more than fat. In the past year, I put on 3.1 pounds of muscle, 3.1 pounds of muscle, and I lost 10 pounds of fat. So although the scale only changed by 7 pounds, the 10 pounds of fat is the shrinking of the waist, the tightening of the arms, and the 3 pounds of muscle is my core, my legs, my spine. So I was very happy about the biometrics. But then when I went to get my DEXA scan a year later, and it was very funny because they were like, the insurance isn't going to cover it. And I said, I had intervention. I went on hormone replacement therapy and I did strength training. And what the techs are used to is, oh, you're on a bisphosphonate. Oh, you're on Reclast or something. And I wasn't going to go to a pharmacologic agent when I knew in my heart of hearts, I'd listened to Andrew Huberman and Peter Attia, and these are my guys. And I love the fact that I could take what I've learned from everybody, put it into the basket for me. And in my last scan, which I did, which was 1 year after this whole thing started, my lumbar spine, which that's where you lose height, my lumbar spine went from a T-score of minus 2.0 to minus 1.4. I increased my bone density by 7.8% in 12 months with strength training and hormone replacement therapy. And my scan, and I'm going to put all of this in a blog post on I have a blog called The Buzz. So I'm going to put this whole thing on a blog post so we can link it to it so that you can actually see the visual measurements where I went from my bone mineral density being in the negative to my bone mineral density coming just above the positive in my lumbar spine. And my hip went from a minus 2.1 to a minus 1.7, which is a 6.8% from baseline. So in 1 year, in 12 months, I changed my body composition, which I think a lot of menopause is bad for your metabolism, I have to say. And those changes, the subtle changes with the HRT, and I'm not going to stay on it forever. I'm not going to be someone who's 90 years old begging for my hormones. I need to get my bone density back to above normal and then maintain it. And I just don't want to be that person who falls and breaks their hip and ends up incapacitated because people think that, oh, it's a broken bone. It's bedridden sometimes, risk of clots.
It's what leads many people, women especially, to the end of their life. They spend these years in misery. And I brought this up in a recent conversation to you. I think the results that you already achieved are so phenomenal. And I think it is not just a moral crime, it is a crime to keep this information from women. So many people suffering could be alleviated. I mentioned this a couple of weeks ago to you. There's a woman I want to connect you with. She was also a guest on this podcast, Dr. Jennifer Garrison. She has the Garrison Lab at the Buck Institute. She actually won the X Prize, Peter Diamandis Initiative this year. I was so thrilled to see that.
Awesome.
One of her big missions, one of her big focuses is to actually eradicate menopause, or at least the symptoms of it, because she says the inequity, men also have something called andropause, but it's much less pervasive. You can joke about it like that's when they get the sports car and the girlfriend that's a third their age because stuff's changing. I get nervous subconsciously. But the effects of menopause on women can be so debilitating, from bone density to mental health to cognitive health, let's talking Alzheimer's, to something like even premenopause, perimenopause, which has gotten much more airtime, and I'm so grateful for it. They have now discovered that as you go into perimenopause, which for some women can be 10 or even 15 years before menopause actually hits, with each year, your estrogen levels drop. And concurrent with the dropping estrogen levels, your systemic inflammation rises, which is the perfect breeding ground for a lot of chronic diseases and really not good issues. So I love that you are now being a galleon's figure for this. And we've talked about the flawed study there. We've talked about the myth that estrogen in particular causes breast cancer. I have a question for you more particular. This was also part of the materials you sent me. So I have some friends who are on hormone replacement therapy, and their different doctors currently still concur on when they're actually given estrogen to also give them not necessarily progestin, which, as I understand, is the human created version of it. That's also in a lot of the pills to prevent pregnancy, but progesterone. What is your take on a combination therapy of estrogen and progesterone, maybe also some other things, but let's focus on these two.
So the first thing that every woman needs to understand is the reason why when we put women on hormone replacement therapy, if they have a uterus, they need to go on estrogen and a progesterone combination. I happen to take my estrogen in the morning and I take my progesterone at night because the progesterone can actually help at nighttime with sleep. And so I separated out. That was a recommendation by my integrative doctor. In the 1940s, the FDA made it okay to use estrogen for replacement, and it had much wider use in the 1960s. In the 1970s, progesterone got added because they found out that the women that took what we call unopposed estrogen, so if you've got estrogen just stimulating the uterus, there was a higher risk of uterine cancer. And so for us to not recognize that, and that it took a while for that to happen. So if you have an intact uterus, like I do, you need to have estrogen and progesterone for replacement. In 2002, that's when the first Women's Health Initiative came out, and they made it sound like if you took hormone replacement at all, that you had a higher risk of blood clot, stroke, cancer. But they didn't look at the subset of women that were being evaluated or put onto those trials, because they were women that were older, that were already at higher risk because of their BMI and because of their smoking history. And so there was a small risk, but it was only this increased risk of breast cancer was just with the women getting the estrogen and progestin, so the combination. And they never really said, hey, listen, we've never seen an issue with estrogen alone in women without a uterus. In fact, we see a decrease in breast cancer. And so my take is with this, like with everything else, every woman needs to sit and talk with their physician individually, because different people have different risk factors. My medical oncologist, who I'm very dear friends with, he's like, don't go on hormones because of your factor V Leiden. And I'm like, let me look at all the risks and benefits. I went through 2 pregnancies, never had an issue with clots. I traveled the globe flying. I've never had an issue. I've had injuries on muscle. Like, I've never had anything that has shown me that I am going to clot, even though I have this risk factor for increased clotting. And yes, hormone replacement can slightly increase that risk, but it's a risk-benefit ratio. And I chose to take a slight risk because of the benefit of the hormone replacement therapy. Okay. So when people, I get sent a lot of patients who've been followed for family history of breast cancer, whatever, and their gynecologists want permission, like they're coming to get me to sign off on it to say, yeah. And the thing is, there no risk at all with taking hormone replacement? No, there's a small, but it's a calculable risk, which compared to the other risks of mental decline, bone demineralization, loss in height, increased risk of fracture, and the symptoms of menopause, hot flashes, sleep, everything. I think that we are doing women a major disservice to not have those conversations with them. The hardest group to get on this bus, and believe me, is medical oncology. So medical oncologists they're in their lane. And we know all the studies have been done that even breast cancer patients currently undergoing treatment who have vaginal dryness and symptoms of atrophy, which to me is the worst thing that we do. Patients will always say, how can disease up here make me so miserable down there? Because when you have vaginal dryness and loss of libido and painful intercourse, I said, nobody goes to the Sahara Desert without water. It's miserable to be in the desert. And vaginal estrogen has negligible systemic absorption. So we're hurting patients by not giving them vaginal estrogen. And even just to treat that localized process. I have a lot of patients post breast cancer who are 5, 10 years out and they're miserable. There were young women who got diagnosed and the medical oncologists don't even want to touch it. And you have to treat the whole person. And you look at the risk benefit ratio of each person at every phase of where they are. And for women that don't have a uterus, it's easy. They can go on estrogen alone because there's actually very strong data, 20 years of data to show that there's actually a slight decreased risk of breast cancer in those patients. And how do we explain that? I don't know, but it's the combination of the estrogen and progesterone together that has that slight increased risk of breast cancer.
Yes, thank you for answering this, Beth. And I personally am also a big fan of hormone replacement therapy. And whether you take the prescription hormones or you also or work with, it can be herbs, you can mix and match as long as you work with a practitioner who really knows what they're doing. Or you can just go the herbal route. There's fantastic traditional Chinese medicine formulas for that, or you just do the HRT route. And I credit this personally with, in my case, for example, it has been very helpful also with mental health symptoms and the muscle density or muscles alone. I see women my age I'm 47 chronologically now. Biologically, that's, as we both know, a very different thing, who are dealing with things that, knock on wood, I have never dealt with. And I feel incredible. I know people who have been suffering from things that I really am convinced are not necessary to suffer on. Another guest, she is the CEO of Glycan Age, somebody else I ought to connect you with, Nicolina Laus. She actually said that, so they measure your true age, your biological age. They can even 10 years ahead of even onset of diabetes, they can tell you that, yeah, you will get diabetes if you continue on this path that you're currently on.
Yes.
But they'll also tell you a lot of ways to actually avoid this. She said one of her the top three things for women for longevity, extending lifespan and health span is estrogen. There are more and more very informed voices that are starting to talk about this. And of course, personalization is really important. What is your perspective on personalization of HRT protocols for patients, and what factors in particular, you already mentioned a few, should women and their physicians consider when they design a treatment plan?
Perfect. First of all, I think it's very important to understand that if you have risk factors for chronic disease such as obesity, diabetes, hypertension, you're already in a state of inflammation that can be incredibly detrimental to your health on so many different fronts, from cardiovascular, from if you're a smoker. There are just things that there are a few things that are going to be non-starters for putting you on hormone replacement therapy, because the temple that our soul has chosen to be in is only so resilient. And you don't want to add other layers on top of that to lead to chronic disease. And one of the things that I have really been hammering home lately, particularly for young women in their 20s going into their 30s, a lot of these young women are like, it was really, we used to do aerobics big time when in my 20s, like I would go to aerobics classes. But strength training is where it's at. When you get 30, 40, 50, I got my daughter-in-law to start doing strength training last fall. She was a marathon runner. This is the one that's having the baby in June.
Mm-hmm.
And both of my daughter-in-laws work out. They're very much in shape and it's wonderful. But the strength training piece, women tend to never really focus on that. And if we started doing our strength training like we need to, and think about it, 100 years ago, women didn't sit in front of computers to do their jobs. They were doing much more manual labor, even around the house. Laundry, we didn't have all the comforts that we have now. So it was like, there was a lot of resistance training in our day-to-day lives, picking up things, moving things, just house cleaning, just all the stuff that women were doing 100 years ago that we don't do now. So our bodies haven't really adjusted to the newer version that doesn't have resistance as part of our day-to-day activities, which is why the strength training is so important. Even 20 minutes a day, 4 days a week is going to do it. You don't need to have a gym. I have a strength training program that I do when I travel in my hotel room, which is push-ups, squats, and crunches, because it gives you those muscle group movements that you need to have to maintain your lean muscle mass. So first things first, before someone is going to consider going on the hormone replacement therapy, they need to take a really good accounting of their physical self. Also, sleep is an incredibly important factor. And for a lot of women that don't sleep, it's because they do have hormone dysregulation. And I've noticed my sleep is better, but I also use my Gateway sleep spray. So I can't stop. I'm not going to stop using them because it's amazing. So
Oh,
my
quick
somna,
interjection, Beth, and just you are an incredible woman who is, aside from having this full career that you've had for the last 38 years, you are also involved with incredible initiatives, and one of them is my husband Clay's company, Gateway Sciences, where we have a big focus on extending lifespan, health span, and also mental health. We have a clinic here where we offer ketamine IV therapy. And so just so the audience understands,
yeah,
the spray you were showing was our sleep spray. It's an oral sleep spray. It's literally
it's amazing. And I also last year my vitamin D was low, and I became very religious about using our D3K2 supplement, which my vitamin D soared. Like I think I was 35 and I was taking an oral supplement of 3,000 a day, and my vitamin D was up to 60. So I didn't check it throughout the year, but I just started using the spray vitamin D3K2. And so a lot of this is like the quality of the things that you're using to try to rectify your opportunities for improvement, let's say. If a woman is nearing menopause, and this is really where we need to address this, is as you're coming into menopause, you can get your labs drawn so you know where you are, whether you're still ovulating. And those perimenopausal years, if you're not having symptoms of menopause, but you have other risk factors for osteoporosis and osteopenia in the future: alcohol, caffeine, lack of strength training. If you haven't done resistant things, like I couldn't believe that I could have osteopenia because I was a gymnast for years. I was an athlete, a diver, but we don't do as much resistance training as we used to just in our day-to-day life. But I think that every woman needs to know that we're at risk for this. They need to get a baseline DEX. So I probably should have gotten a baseline at 45. Even if my insurance wasn't going to cover it, I should have gotten a baseline at 45 to know where I was, because I don't know what my bone density would have been back then. I waited till 62 because I inappropriately thought, because of my history of fitness and the amount of resistance that I was already doing, and the fact that I was doing that resistance training and I didn't have the bone density I thought. The big difference this year was hormone replacement and adding Ben Oldest to my life. So he's the trainer, he's not my husband, but that I think that made the big difference.
Yeah.
And I'm now counseling so many people are calling me, asking me. We were at a wedding in Ireland and I've been helping this. She's a musician in New York, and she went and got a baseline, and they're very quick to want to put her on drugs. And they're telling her that she needs to do this because she's got osteoporosis. But she did all this. She looked at all the information on the bisphosphonates and said, yeah, you build bone, but it's a different kind of bone. And I'm not telling women not to take those medications. I'm just saying that what we need to do is have a bigger picture of all of this. The medicines that we give our patients for the anti-estrogen medicine for breast cancer, it can lead to necrosis or issues with the jaw, but so can the bisphosphonates. So we have to look really carefully about what we're doing in the long term.
Yes, and to your point, my mother is dealing with some osteoporosis. Bless her, she's in Germany, and she was also told, oh, she can take this medication, but it may impact her jaw. Like her jaw may deteriorate. I was just like, what? That's the option? That's ridiculous. And you just spoke about women who are getting evidence that they're going into menopause. So the exchanges I have had with other individuals like Dr. Jennifer Garrison, other scientists as well, is that they actually say it's quite important to get your baseline, like what you said, for example, with the DEXA scan, to get your baseline at a much earlier age.
Yep.
You can actually, and not just for bone density, for everything, get regular
Yeah.
full hormone panels, etc. Because once it starts changing, you want to be able
Right.
to tweak it then, not when the big symptoms are showing up, when already so much stuff has been going on in your body. So what's your...
And when here's the funny thing. A lot of people say, why don't we hear about this in men? But we're more likely to get osteoporosis than men because we have less bone tissue to begin with, and we lose bone faster after menopause. So that's why that menopausal time is the prime time for us to say, okay, well, let's look at your risk. Thin women, my sisters that have a higher BMI have a normal bone density. And I think it has a lot to do with BMI, that they've had more stress on their bones because they're carrying around more weight. So they're constantly doing stress. They're stressing their bones. Caucasian women and Asian women have the highest risk. It just is what it is. My mom had osteoporosis, family history, medications. If people are on steroids, some people are on steroids for autoimmune disease, proton pump inhibitors, some anti-seizure medicines, not having a diet full of enough calcium, green leafy vegetables, vitamin D. And a lot of women that are trying to lose weight don't eat protein. It makes me crazy. Like, protein is the most important thing to have in your diet if you're trying to lose weight at all. And that was one of the things that when I started this process last year of I was very conscious about this, is I really wanted to be able to build muscle. And you can't build muscle without protein. If all you're doing is cardio and you're burning fat, you're going to end up burning your muscle as well. I think it was Peter Attia that was like, okay, if you're going to do a strength training treatment, you got to have protein before and protein after. And it's got to be like, you got to have 30, 40 grams. You have to actually. So I started getting my vegan protein powder and doing that with PB2, the peanut butter, so that I had it. So I was actually giving my body what it needs to build muscle. The other thing is heavy coffee drinking, heavy smoking. What was really blew my mind when I looked into all of this is swimmers have a high risk of osteopenia and osteoporosis because they have no resistance on their bones. So people that are exercising and their only exercise is swimming, you need to add something that builds resistance to. You've got to do squats or push-ups or some kind of hiking or walking. Axial loading. I didn't really learn about axial loading until I had osteopenia, and then I started looking at it. So carrying that heavy pack on my back, climbing up the back of the mountain for 3 miles made a difference. Metabolic conditions, celiac disease, rheumatoid arthritis. Obviously, anyone that has premature ovarian failure or early menopause, late menstruation, early menopause, they should be going on hormone replacement therapy. And these are things that doctors should address, but not. And this is my beef with Western medicine now. We've become so siloed. And even primary care docs. My primary care doc, Jason, is wonderful because I'm a doctor. I should know this stuff. But he got in my face about it anyway and said, listen, you need to read this book. You need to pay attention. You need to do all this stuff. And I haven't seen Jason probably in 6 months. And he's going to look at me and go, wow, you paid attention. You did what I was supposed to do.
He will definitely say, wow, and shout out to him. I love that. That's what somebody who takes care of your health should be.
He's a stud. He's a star. His wife, Angie, they run an amazing practice called Helios Medical in Sedona. He left his other job and runs an incredibly affordable concierge practice because he loves empowering people to be healthy. He didn't want to just keep treating disease. And the thing about strength training that a lot of people underestimate is your body breaks down old bone and builds new bone when you're doing strength training. So this makes your bone stronger in a natural way, not by giving you a drug that's going to lay down not strong bone. Bone remodeling, it maintains our bone, and it also helps reduce the risk of fractures and other injuries. And then the other thing about resistance training, like things that I do, a lot of the exercise require coordination and balance, and that helps reduce the fall risk. And when you fall as an older adult, you have a much higher risk of breaking bones. Now, my partner's not old. She's 55. But when she fell, she tripped over her cute little dog, like Teddy, was in the way, tripped over the dog, didn't want to hurt the dog. So instead, she fell on her elbow. And that fall just broke that little bone. And so I think it was the perfect storm for me last year with her diagnosis, my diagnosis. We're both breast surgeons. We've been so anti-estrogen because that's been our lives. And so it was like having my partner as a breast surgeon and I going through this together saying, hey, we need to pay attention to this. And fall production, I fell down the steps last year at my son's house and smacked my knee. Didn't break anything, but it also was like, okay, do you really need to be wearing those shoes in the dark, in the winter, that have high heels? Wear your sneakers, go to the office, don't be a slave to fashion. So I've got my psychedelic Vans on today and I still wear my high heel shoes. I just wear them very carefully. So I think those are all things that doing the exercise, changing our lives and talking to our patients about estrogen and progesterone replacement therapy are so important. This doesn't mean that I don't want my patients to take the reclass, the zoledronic acid, or the bisphosphonates when they're needed and indicated, but strength training across the board will always help you build better bones.
100%.
Helps you have better balance. So even if you can't take hormone replacement therapy, get to the gym and run away from the treadmill and spend your time lifting weights, building muscle, because it's going to burn more fat and it makes your genes fit better too. So there you go.
And this leads into my next question, actually, Beth, because not all women may be candidates for HRT, even though between you and I, we're both big proponents of it. Or some women may just want to look at alternative approaches. So obviously strength training. What are some other non-hormonal strategies that, or lifestyle changes that you can recommend for managing menopausal symptoms and also to promote holistic health?
Got it. I'm pulling this up because my friend sent me this a couple weeks ago. Ginseng is better than drugs for osteoporosis.
Ginseng.
I'll send you this. You can add it to the post. Female ginseng, known as dong quai, is a popular remedy for osteoporosis in traditional Chinese medicine. I know a lot of my patients have been on it. It also helps with hot flashes too, because it clearly must be hitting some of the same receptors. For menopausal symptoms, there are several non-estrogen forms of hot flash relief, some homeopathic. And my personal belief is if you can find the root cause of hot flashes, which a lot of times I see it as it's sympathetic, parasympathetic dysfunction. This is one of the reasons why technology that we're using to stimulate the vagus nerve is so important, because if you are in cortisol storm all the time in fight or flight, it's very hard for you to be able to calm down and to sleep. And when you are in metabolic dysfunction, when you're out of balance, the hot flashes and things can come because they're like a surge of your hormones. I never really had bad hot flashes. I hope you don't get them. But there are several things which some of the names are escaping me at the moment because I do this all the time in my office, but I'm forgetting what they are right now. There's samples sitting out in the hallway. I know that, but I'm going to give them to you to put in the show notes because hot flashes are a pain and I can't even think of the names. I'm having a senior moment right now. I probably need more estrogen. I did take it this morning, but
That's
it
perfect.
popped out of my head.
When you come up with it, just send it to me and we'll pop it in the show notes. I'm sure the audience will be very grateful for some input there, particularly the women and those long women. You mentioned it much earlier in our conversation, and this is something that is really important to shine a light on. Women's health has often been sidelined in public, in medical discourse, studies, and which has led, of course, to a lot of misinformation, also inadequate care. Regarding that subject, Beth, what changes would you like to see in how women are educated about menopause and HRT, both in medical training, but also in public health initiatives?
First things first, I think that we need to start at the physician level, and we actually should have education in medical school on women's health, on menopause, on osteoporosis, on nutrition, on exercise, because women have very different needs than men do. across the entire spectrum of our lives. We don't get educated in general about what women should be doing if they're planning to get pregnant or want to get pregnant. Gynecologists do that stuff, but that's something that should be like every doctor should be educated on women's health. I think we need to have more studies now on hormone replacement therapy. It's just that it became such a third rail issue. I would love to see a hormone replacement study done on women in their late 40s, early 50s that are legitimately going through perimenopause and see if we can support a woman through that phase. How does that translate long-term into bone density? Because we wouldn't be potentially losing the bone density. I would love to see more studies on women in exercise and nutrition about if we start a different program of exercise at a younger age, like again, women in their 30s and 40s with strength training, really pushing that envelope. What kind of things can we prevent? And I think that across the board in healthcare, we need to get a grip on the obesity epidemic, because as I listened to Casey Means say in a podcast recently, he said, childhood obesity is not a Ozempic deficiency. Childhood obesity is a parenting deficiency. And it's a lack of good access to food deficiency. It is a food desert issue. We're the unhealthiest country in the entire world. And I think that women are the CEOs of their families. The moms are running the show. And we need to have a greater focus on providing psychosocial, emotional well-being for women, because if you're in charge of the family and you're in charge of the household and you don't feel healthy, whole, and complete yourself, we're never going to have a healthy society of children.
100%. Mm-hmm.
And I would love to see women's health as a super specialty. Right now, we are seeing survivorship medicine become a specialty, which is what, I know how to treat cancer. I need to treat other doctors. I need to teach other doctors about how to focus on survivorship and treat whole people who have gone through cancer and support them through the rest of their lives. And then that translates into, how do we prevent cancer? We prevent cancer by decreasing inflammation, by decreasing toxins in our world. I have a lot of friends who are freaking out about the election. And I said, you know what? You can only change what you can change. Don't look at, oh my God, RFK is going to freak out and change so many things with the FDA or whatever. He has a lot of great ideas about our food sources, about the pesticides and the dyes and the toxins that are in our food system, and the processed foods that have become a standard of care mainstay for most of America.
Yes.
And getting back to those root causes is how we're going to change healthcare.
Yes. And the truth is, the medical system, the healthcare system, insurance system, it all needs to get shaken up. It is clearly not working. There's clearly so much suffering, and the individual suffering, the community suffering, the suffering all as a society, as a culture, as a whole, is, even if you want to be very pragmatic and not even look at the human cost, the emotional cost, but if you just look at it financially, what it costs a country to have so many people sick and suffering and just be patients for the rest of their lives, it keeps us from thriving. So, and to button the
Healthcare,
yes,
healthcare's lost its. I mean,
yes,
I went into healthcare as a healing profession. I'm a healer that chose to be a doctor, that chose to be a surgeon. Healthcare has become transactional, and it is a business. And in the United States of America, now I'm going to make people angry, but I don't really care. The business of medicine runs because people are sick. And when you are sick, you need to access the health system. You need to access pharma. I am not dissing Western medicine. I love it. If I have a ruptured spleen, I want the trauma surgeon down the street to be able to take care of my acute injury. But we need to get the focus away from acute care management, go to functional medicine, go back to finding and treating the root cause, which in many ways is nutrition and exercise. And most importantly, psychosocial emotional well-being.
yes,
If you are depressed and anxious, we need to address those underlying causes, because I can't get my cancer patients to exercise and eat well if they live in that constant fear of cancer recurrence or death, which is what brought me to psychedelic therapy and particularly ketamine therapy, because antidepressants do not work in cancer patients the way that they work in the way that they can work short term as they should be in the general population. But ketamine, because it can help someone address their anxiety and fear and the existential crisis that comes with cancer, has become something that I believe will become a mainstay in cancer care. Since that I, got introduced to you and your husband, Clay, because psychedelic therapy has such a huge role to play in healing. And currently ketamine is our psycholytic, our entheogen, as I call it, that is currently legal. And it saddens me that a lot of people have said, oh my God, that's why Matthew Perry died. Matthew Perry had addiction, which is so sad. And he was trying to medicate his addiction, and bad people, doctors and others, underground, gave him access to what otherwise is a safe and beautiful molecule, which has so much potential to help people. And that's a story that needs to be told over and over again, that ketamine did kill Matthew Perry. Unfortunately, he had addiction, he had demons he couldn't deal with, and he got access to too much of a medication that he took in a hot tub, and the drowning led to his death. So
Exactly.
that's my
Been
point on
issues.
that one.
I agree with you. I share that viewpoint, Beth, and it is tragic. It is very sad what happened to Matthew Perry. And I think the individuals who indirectly and directly caused this, it's absolutely despicable. We have personally seen at our clinic, Gateway Clinic here on Montana Avenue in Los Angeles, we have seen such incredible changes in patients who come in, who you can literally see they're carrying the weight of the world on their shoulders. And oftentimes, even after one treatment, they are changed, right? They have oftentimes a new lease on life, even to just see that it's possible to, for the period of time of the treatment, but sometimes sustainably longer, to get out of this depression or anxiety or whatever they're dealing with. That
My very first time at the clinic, I was there when a woman who was going through chemo concurrently was there for her session. And I saw her before and I saw her after. And afterwards, she said to me, the blessing of my cancer is that I've been given this opportunity to do the ketamine, to heal things that I didn't even know I needed to heal. And so I find that silver lining of my cancer being that gift that she was able to, or someone suggested that she do ketamine therapy, because we all have demons. We all have stuff. Everybody has stuff. Some of us tuck it away, farther away, but that's the piece of healing in cancer care. That is what brought me to psychedelic therapy, is that I can cut out the cancer. I can give the appropriate medication, the surgery, the chemo, whatever. But if I cannot heal those core wounds in the souls that choose to come to me for their treatment of cancer, then I have not done my job, which is why 2025 is my major shift. And in my second book, which is getting edited right now, called Shifting Gears, Living Life with Intention, it is all about, yes, we need to, I'm not throwing away Western medicine because it has amazing gifts for us, but the way we treat cancer treats the physical body. The soil and the seed theory, we improve the soil with nutrition and exercise and ecology, building our immune systems. That final piece, which to me is the most important piece, which is why God brought me on this path where I am now, is that piece to heal those traumas, whether it's trauma therapy, TRTP, ART, ketamine, psilocybin, ayahuasca, iboga, whatever it is that a soul needs to bring us there. And so I'm given the great gift to be able to work with Gateway, to work with Interstill Health with Mind Vibe, to stimulate the vagus nerve, to have a non-narcotic way to treat pain with Signal. Every company that I've been brought in with all plays a role in how we help a human heal and become healthy, whole, and complete to go on with their lives.
Yes, Beth. And these are incredibly beautiful closing words for a beautiful conversation. I'm so grateful you made time for this. I know this is going to be priceless for so many listeners who are on the fence or worried, and to inspire them to follow their inner voices, to not just listen to what gets told to them by one person or another, but follow that path. Trust your inner healer. Trust that there are so many different ways of achieving healing, and even those that seem unconventional as of now. And thank you for all the incredible work you do, Beth. Thank you for being such a good friend and such a light and a healer in this world.
Thank you for the opportunity to spread the light.
Superhumanize. Accelerated evolution.